So I think I'll perhaps start by explaining NNAG's involvement. So since the onset of the pandemic, NNAG have been working with the neurosciences community to monitor and to understand that impact. We've worked with our subgroups. We have the patient group forum, of which there are many members here today, our core group, and also our close involvement, close work with NHS England and the CRG. But to understand it in a little more depth, we put out a call for evidence in September 2020. Now there's been a plethora of resources that have come from the neurosciences community, clinical guidelines, or clinical guidance, excuse me, clinical guidance, advice and guidance for patients. Our pathway leads have also been adapting and reviewing the pathways in light of changes that have come in due to COVID-19. So to understand a little more the context and the whole picture review, we've held discussions and interviews with NNAG members and stakeholders to develop the report, to understand the impact across neuroscience services and for people with neurological conditions, and also to develop useful recommendations at a time where we are still in the midst of this pandemic and it is continuing to unfold. So Georgina has gave an excellent outline at the beginning about the impact and how some of that impact is being felt. Essentially, our reports found that the pandemic has highlighted and exacerbated gaps in care for people with neurological conditions across health and social care. So areas like neurorehabilitation, access to mental health care, access to social care have all been have all been impacted on, have all been felt. I suppose it's important to draw out the variation here and say that there's variation in the way that services have been impacted, and this will be down to a number of factors, which could be rates of infections in certain areas, and the digital maturity of services, and then the ability to redeploy staff, amongst others. And just to give you an example of some evidence that came from neurophysiology services, it was restrictions such as the buildings that that clinics are held in is also, impacting the ability to manage social distancing requirements. So, in addition to, I suppose, some of the longer standing issues that we might recognise, there's also an increase in demand on services now due to COVID-19 patients and or long COVID syndrome patients. And so as we go forward and as we plan for the future, this increase in demand and the capacity of services needs to be taken into account. And essentially what we're seeing is the fragility of the system, of an under-resourced system. So it's exposed perhaps challenges with outpatient coding and how we were able to promptly and quickly identify our extremely vulnerable and clinically extremely vulnerable patients. It's exposed challenges with workforce, and then the data or the systems that support that workforce. So our recommendations, it's important that our recommendations reflect this, that we look at actually the short-term immediate recommendations that we could make. For example, returning staff or specialist staff that have been redeployed as soon as is possible, of ensuring that there is effective triage, ensuring that there is an evaluation of digital care, virtual consultations, and that we truly are able to understand the outcomes from the care that has been received during this time, during this pandemic. But then we also need to think longer term. We need to think about the resilience of the system and supporting the system so that it can it can continue to deliver good care or quality care for people with neurological conditions, and be resilient to crisis and to impact that may come in. So there, it's outpatient coding. It's thinking about leadership within neurorehabilitation and plan for neurorehabilitation. It's ensuring that there is clarity on funding and adequate tariff or reimbursement from the tariff system. And so we're in the final stages of this report. It's being reviewed by NNAG members. We're expecting publication early December. I know some of you have been involved in submitting evidence and involved in interviews of that report. So I want to say thank you so much for your contribution. We'll be circulating details of our comms plan for that and how to support the report in the coming weeks.